A great question is how often should I get my eyes checked after surgery? So cataract surgery, RLE surgery, ICL surgery. Now, if your eyes are quite healthy and you don't have any diagnoses such as glaucoma suspect, open angle glaucoma, macular degeneration, dry eye, conditions that may get worse. If your eyes are otherwise healthy and no diagnoses, I would say come in once a year. Usually the practices that I operate out of just do surgery, so we don't do the annual exams, but go to your normal eye doctor and get your eyes checked out. Because you never know if at some point someone will catch something, and if you were predisposed to macular degeneration, glaucoma, you'd want to catch that early because there are treatments. So it's quite important to even having healthy eyes for now, just to keep an eye on things. Certainly, if you have symptoms, go in, sooner than later. And it depends on what your symptoms are. If you feel like there are urgent symptoms, for instance, flashes or sudden hundreds of floaters, then you'd want to be seen immediately. But it really falls on the patient to call and report any of these symptoms, because the sooner we can catch something and address it, the better the outcome. Now I've not had a retinal detachment after 1,000 surgeries, but they happen, and you don't want to leave that, right? So if you have new symptoms, particularly concerning ones like flashes and floaters, you'd want to call the practice and come up with a plan with the practice to figure out what to do next. Now, if you did have an eye condition, hopefully your current doctor has determined a good interval for follow-ups. So for example, if you have open-angle glaucoma, maybe your intervals every 4 months you get your pressure checked, and every year you get all the testing, the visual fields, the OCTs, the pictures, and similarly, and these are the more common diagnoses like macular degeneration. You probably want to come in every 6 months, depending on the severity. If you have a very severe form of it, or quick moving form like wet macular degeneration, you may be coming every month, every 2 months for treatment. So yes, I think for the most part, in the patients that we see, these are healthy eyes. So a good rule of thumb is no less than once a year. But if we determine that there was something, maybe something progressive about your eyes that to keep an eye on, we make a recommendation and tell you to and refer you to an appropriate general ophthalmologist or optometrist to keep watching with you and just make sure things are stable, and if anything were to progress, that we catch it early and treat it early, so we have a great outcome. Thank you.